I'm Dr. Rick Greene from the UVA Medical School class of 1970, and it's my pleasure to host this series, which really highlights our wonderful emeritus professors here at the University School of Medicine. And I'm just delighted today to be able to talk to Dr. Daniel Becker, who's professor of medicine, endowed professor of palliative care, and was the director of biomedical ethics and humanities.
Correct.
Did I get that right?
Yes, yes.
You know, I'm fascinated. There's so many things I want to ask you about. I was an English major as an undergraduate here at the university. I was one of only two non-science majors in my medical school class. You have a real interest in the humanities. How did this come about? Sort of tell me about that.
Well, I grew up in a house where books were important, and pretty soon I was reading the books that my parents were reading. You know, it ranged from Plato to Ian Fleming. So I always loved reading, and I was a literature major in college, and you had to do okay in the pre-med stuff, so you know I could do calculus and physics and chemistry, but I missed it in medical school, and I was at Washington University, and I asked the dean of the medical school if they would pay for me to take some night classes. So during medical school I took a Shakespeare class, and I took a 19th century novel class.
As a medical student?
As a medical student, you know.
It's marvelous.
Yeah, I thought of it as an antidote to something that was some kind of medical school toxicity that was, it was hard to, you know, to be using that part of my brain exclusively, the sort of the quantitative part. So I think I needed some uncertainty, some art.
Well, you went to Penn, then you went to Wash U.
Yes.
Then I think you went up north to the Brigham for some training. You went to Miami. How did you finally come to the university? How did you get to Charlottesville?
Well, like all good things, my wife is the answer. I met my wife in Boston, and she was, in effect, doing her post-bac pre-med, and she ended up starting medical school at the University of Massachusetts, and I had accepted a job at the University of Miami. So we weren't married. She transferred to the University of Miami after a year, and the deal was that when it was time for her to choose where to live for residency, I would go wherever she went. And we looked up and down the East Coast. We wanted a strong neurology program, and we wanted to live somewhere where there was an opportunity to sort of live in a field somewhere, not in a suburb. And we arrived in Charlottesville on a beautiful fall day. We parked on Hospital Drive for Lynn's interview with T.R. Johns in neurology. And I was kind of smitten. You know, I liked the architecture, I liked the fact that there was fall. So I called the Division of General Medicine, and I said, "Do you have any openings?" And David Fedson gave me an interview, and I had my interview with David and a guy named John Philbrick. And my son was in a stroller, fortunately napping during the interview. So I realized that this was a family-friendly place.
So the rest is history.
Yeah.
Yeah.
Well, then, you know, Lynn needed to get an academic job here, so she finished her training. She did a fellowship in sort of neuropharmacology with Fred Wooten, and got appointed, her first faculty appointment the same year I got tenure. So we bought a bigger piece of land and built a house, and we decided this was it.
Tell me a little about, you got a master's in fine arts.
Yeah.
Tell me about that and how that has really played a role in your life.
Well, I'm sure, you know, as a practicing physician, you remember back in the late 80s, early 90s, suddenly managed care became important. And one night I woke up and every UVA employee needed a primary care doctor. And there just weren't that many general internists then. Overnight I had, I don't know, something like 600 new patients. And that sort of meant that I really couldn't write grants or, continue to try to do some research. But I liked writing. And I started writing poems and stories, and then I took a class with Charles Wright. I'm not sure if he was around when you were an undergrad at UVA,
no.
but he's a wonderful poet. He still lives in Charlottesville, and so it was me and a bunch of 20-somethings and Charles Wright, and I think he was interested in having another adult in the classroom, and we hit it off, and he was very encouraging, and I ended up getting serious about writing.
Tell me a little about the literary magazine that you started here.
It's called Hospital Drive, and at the time, Tim Garson was the dean and Sharon Hostler was the senior associate dean for faculty, and they had encouraged me to get involved in the medical humanities. We talked about a magazine, and I said, okay, I think we can do something, an online magazine, not a print. I said, well, what would the name be? I said, how about Hospital Drive? And Tim Garson, the dean, said, that's a terrible name. But I like the name. I still like the name.
How many years have you been doing the magazine now?
Well, it's kind of on leave now with me. When I retired, it was hard, for anyone to sort of take it over. So it was really from around maybe 1998 through 2018.
What kind of things did you really want in the publication? What were you looking for?
Well, we wanted people who had a story about illness, recovery, suffering, so definitely themes that were medical. And we were interested in giving people who hadn't really thought they could write anything a chance to be published. So we liked new voices, and then we started advertising in literary magazines, and pretty soon we were getting accomplished people, people who were actually writing for a living, and then friends of mine, so essays, poetry, short fiction.
So obviously this led into some of your interest in ethics, creation of the Center for Biomedical Ethics.
Well, the geography had something to do with that also, because ethics and humanities were on the same hall, and the American Society for Bioethics and Humanities is a single organization. But they were separate centers. There was a program in humanities, and then a center for medical humanities, and a center for ethics, and then again, I think it was Dean Garson and Sharon Hostler suggested combining them, and it's a pretty comfortable fit. Everybody got along. There were a lot of cooperative programs.
What was the involvement of the undergraduate medical students in the center?
Well, we focused on that because initially they didn't even know we existed, especially when a lot of the undergrad medical education moved to the library. They renovated the library in the late 90s. So we started a program called the Hook Scholars, named after Edward Hook, who was the chairman who hired me.
Sure.
And he had very wide-ranging interests in science and social science and medical humanities. We invited everyone in the entering class of medical school to become a Hook Scholar, but we were interested in people who'd been involved in the arts or social science as undergrads and wanted some opportunity to continue to do that. And we've been very successful in recruiting wonderful students who were writers or had studied ethics or history or music or studio art or history of art, and they were able to do projects with us in the summer between first and second years and as fourth-year students as electives.
So do you think as a global issue, students have more interest now in the arts and the non-scientific part of medicine? Is that something that...
That's an important question. From what I understand, that undergrads are less interested in departmental majors like English, history, psychology, as they are in interdisciplinary majors. So people are majoring in biology and bioethics. They're majoring in biochemistry and sociology. So there are, so we find students who were studio art majors, and then they decided to go to medical school. They did the post-bac program somewhere. By the way, UVA has a wonderful pre-med post-bac program with close to a 95% admittance to medical school. So there are people who have had backgrounds in the humanities and come back to medicine. And we argue that kind of a background makes better doctors. It makes people curious, good listeners, interested in sort of the story that goes along with the illness, how the family works to assist recovery, to get in the way of recovery.
So now that you've transitioned from all of those wonderful things, what are you doing now?
Well, I retired on July the 1st, and they rehired me for part-time work on October. I'm teaching medical students 2 afternoons a week, and there was a sudden vacancy, and that comes pretty naturally, and basically we're teaching them how to talk to patients and how to listen to patients and how to lay on the hands in a way that's not discomforting, and some clinical common sense. So it's the kind of teaching I've been doing my whole career. I mean, when you graduate from medical school on July 1st, you're an intern, and there's a medical student standing next to you, following you everywhere, and you have to be a teacher as soon as you're an MD. So I'm doing that. I'm writing more. I'm trying to put a book together, which means developing some correspondence with other writers and getting some feedback, and that's going well. And around the same time I started creative writing, I thought, well, what else have you always wanted to do and haven't done yet? And I've always wanted to build a wooden boat. So I've been building wooden boats in the shop next to our house.
Wonderful.
So I'm building what I think is going to be my last wooden boat, because it's time to start using them. So.
Well, I can tell that you're a wonderful mentor, and I can say that probably students who've had you as a mentor are very, very lucky. And I congratulate you for all the wonderful things you've done. We've been talking to Dr. Daniel Becker today, who's done so many wonderful things, but clearly he's been a role model for students here at the university in the medical school who have an interest in humanities and all the things that physicians should be doing. So Danny, thank you for being with us today.
Thank you.
We really appreciate it.